Hi, I'm Jeff Forster. I'm the lead pastor of Heritage Church. We have two locations, one in Sterling Heights, Michigan, and one in Imlay City, Michigan. And I just want to welcome you to this first episode of A Doctor's in the House with Dr. Bisham Singh. And our purpose behind doing this show is to provide a local perspective on the coronavirus pandemic from medical doctors and from scientists and from other community leaders. And so if you're watching today from Facebook or YouTube, we want to invite you to send in your questions. If you have any questions that you think that Dr. Singh would be able to answer for you, you can use the comments section in both of those. And at the end of the program, we'll take a few minutes to answer as many of those questions as we can. So Dr. Bisham Singh, welcome to the show. And I want to thank you for taking time to join us today. Dr. Singh, tell us about some of your background. How did you get into medicine? What was your intent? What was your focus in the medical field?
Well, thank you, Pastor Jeff. You're asking some questions why I went into medicine. Well, I think since I was, grade 3, I always wanted to be a physician, a surgeon. I used to practice pretending I was, I was always a doctor. And, always you'd watch Little House on the Prairie and you'd look at Dr. Baker and you always wanted to be that doctor. And I think I got transformed into medicine early on. I always loved science. I liked experimenting, and I was just curious about the way things work and how God's creation, how things actually could manifest, how they were alive, and what would make them alive. And so, my love for science led me to that career. I went to originally from Canada, Waterloo, Ontario, where I went to school there, and then I went to McMaster University in Hamilton. I did my undergrad there and did part of my medical training there. I obviously came to the United States because it was a great country to be in. But my wife was actually from South Carolina, and met my wife, and we moved, and loved it since then.
Huh. Well, that's great. So then what has been the focus of your medical career? Are you a specialist? Are you a general practitioner?
Well, so I came into the urology program there at the Detroit Medical Center. I was in trauma and reconstruction urology under that program. And for many years, I was under that program. As I was practicing medicine there in the clinical academic medicine practice, I came up with an idea called concept called Code Blue. And what a Code Blue is in a hospital when there was a crisis, and I think many patients and many people are aware of, when there's a code, there is a rapid response from a team that's ready and available to serve that patient. So whatever that code is called, the patients would come. That I wanted to take not only to the hospital, but I wanted to take it to the country and globally. So I said, the world is our patient. All these people are our patients. And so if there was a crisis, we should be able to rapidly, teams of physicians that want to help, just that are retired or they're home or they have a break, that we should be able to respond to some kind of a crisis. So that code, I went to, we formed Code Blue and helping with missions around the world. And then the chairman of the hospital ended up giving me a fellowship. And so I was a senior administrative fellow. And I got taught how to, basically, there was 2 positions in that 9 hospital systems. And he offered me one of them. And that was to help hospitals, help being able how to understand how hospitals ran, how the integrations of all the systems. And so from there, we got into more of the administrative medicine role. And I thought that was my function. I loved it. I enjoyed it. And I thought I could do greater good when you're starting at that level and that you can help a broader area. And it was more in line of what I wanted to do.
So a lot of your medical...
we started looking at hospital systems and getting our systems into theirs and helping revitalize some of these hospitals.
So then a lot of your medical experience has also been not only local but global in helping developing nations and developing hospital systems around the world. So you have a unique perspective to this global pandemic thing, and that's one of the reasons why we thought it was a good idea to come on and talk about these things. Um, and then also, just on a side note, you're probably not going to mention it, so I will. Dr. Singh, you're also running for the 10th Congressional District to represent the state of Michigan. And I think it's a great idea for a doctor to be in the House. I think that's how you're running. People can get more information about your campaign at drbishamsingh.com. Is that correct?
That's right. You just said the website there. It's drbishamsingh.com. Maybe you could put it up. I got an approach. I've always been involved in the political aspect of things in our society, in our medicine, and I think you have to be involved. If you don't, someone makes the choice for you. And what I was watching is what was going on with our healthcare system. As we have one of the best healthcare systems in the world. Now, granted, we have flaws, and we're working at it. And I think both sides, Democrats and Republicans, want a good system. Americans want the best healthcare system. And when I travel around the world, and I see, and I come also, I have clinics in Canada, and I've, gone abroad. Everybody wants the American model. Nobody wants, the European model. They have the Germans, they have the Europeans, they have the Finnish, they have the Chinese. They all want the American models. They want our EMR. They want our standard of care. And and here we're trying to deconstruct it, and they want it. And so eventually, I think by faith, and I think sometimes God has a bigger plan, what He wants for you, and I ended up, wanting to help with this plan and where our future of our country is heading. And if we're not careful, before this coronavirus was hitting, I was calling that the country was actually going to go through a code blue with shrinkages of hospitals and infrastructure. And I thought that this was the perfect time. That if there was a time, this is my place to actually come in and do what I can to help. I'm not a politician. I never wanted to be one. I just wanted to serve our community.
Right. Well, Dr. Singh and I met at a White House briefing a few months ago, I guess, in Washington, D.C., and while we were there, he also had a briefing with the Pentagon with regard to the COVID-19 thing that was popping up. And so with both of us having a heart for the world as well as for our local community, both of us being right here in Southeast Michigan, we just thought it was appropriate maybe to sit down and have this conversation. So let me ask you a few questions, and then we'll jump into some of our viewer questions as well. First of all, in the easiest way, what really is COVID-19 or this coronavirus thing? What is it?
So COVID-19, the CO is for coronavirus, and the 19 is from 2019. So this virus emerged from the Wuhan province in China in as early as probably October. I think that's when we first began to hear some cases. And maybe prior to that, maybe a little earlier, I was hearing ramblings of something happening, maybe around October, a little earlier than that. And this virus was behaving not like the typical coronavirus. There's a family of viruses that cause. They usually cause flu-like symptoms, and most Americans probably have had a form of coronavirus. It's a milder form of coronavirus. It wasn't like the other flu viruses that caused the flu. This one was mild. So you would usually get sick. You would feel a little tired. You felt you're coming down with something, and you would go to bed. Mm-hmm. And the next morning or the next day, you would wake up and you would be fine. So it wasn't that contagious. These family of viruses usually, like in the past, live in animal species. Primarily the bat species. And so, but this coronavirus was a little bit far more aggressive COVID-19. Because this one primarily came from when you have a problem where it comes from an animal source to a human source, that's where we don't have the immunity level ready to handle that type of virus. And that's where you see our immunity is not as great as it used to. It hasn't been programmed to fight that virus.
So then this COVID-19 is much stronger than the normal coronaviruses that maybe we've encountered in the past.
That's correct.
Is that what you're saying?
That's correct.
Okay. So then with this coronavirus, go ahead.
it's the first time this strain is actually coming in contact with humankind, and so our body is programmed to fight all types, thousands and thousands of infections, of bacterial infection, and all sort of things. So when it comes into, we're not able to host a response to it, and this is where we're having these issues. And so eventually the body will adapt, we will grow, we'll get better, and we'll be stronger. And the next generation will be able to fight that, meaning the next strain of the virus, when we get it, will be able to survive and fight it.
So then, since no human being has ever encountered this virus before, is that one of the reasons why it's just spreading through everybody, is because nobody has an immunity to it? Is that what you're saying?
That's one of the reasons. One of the other reasons is that it is a form of it's a little bit more aggressive. So they would have a factor of viruses. The CDC and even virologists will say there's certain viruses that will infect you. So if you're in a radius, like if you have the flu, you would cough, you would sneeze, you would infect certain people around you, and you would move on, and you would stay away from that person. But this virus seems to affect. We don't know. In fact, that things are changing. How many people can infect at one time? This is why the government's asked us to self-contain ourselves at home and quarantine ourselves to help eradicate this disease.
So then, just briefly, and I know many of us have already heard these things before, but just remind us, what are the common symptoms, the early symptoms, and then the onset symptoms of this coronavirus that we're dealing with now?
So it varies, obviously, in age groups and different people. And again, in my website, in the CDC website, it actually lists the CDC website, the Michigan government sites, and the mandate by the president himself. So basically, you can learn a lot more, get involved more in this, and so the symptoms will vary. But I'm going to give you the main ones. When the COVID-19 started, the people were having some gastrointestinal problems. So they were saying that sometimes you may have diarrhea, you may have some form of diarrhea. Some people may have a respiratory, a cough. Some people will also have a cough. They'll have a headache. So they'll feel like regular flu-like symptoms. I have a headache. I feel tired. And this one also, they have shortness of breath, which is they're having some difficulty breathing, or they're having difficulty, speaking. And so those are telltale signs that there's a chance you were infected with the COVID-19. And so they're asking you to, quarantine yourself at home and call your healthcare provider immediately. So I think if anyone feels that they have any of these symptoms, self-quarantine and call your healthcare, or call 911, or call healthcare providers and say, look, I think I may have this virus. And what do I do next?
So self-quarantining is a first step, but then, and obviously we need to do that if we start to think that we have it, or if somebody that we're around. But then when we go out into public, we have to go grocery shopping or get gas, or if we have to go to work, what's your opinion for lay people, regular people like me, wearing masks and gloves and those kinds of things? Is that necessary? Is that even recommended? I've heard both sides on that opinion with regard to whether or not we should be wearing masks in public, or is it just the sick person should be wearing a mask?
So sick people should not be out. If you're sick, you should stay home, and you should call your healthcare provider or the emergency room or the hospital, whatever hotline that is available for you to call. Again, if you go on that site, you will see a list of stuff. We've made it very easy for people to navigate and access it and how to help. And a lot of agencies also have these sites to contact. They're asking for a 6 feet distance from people. So if you're going, some people, my wife went to the bank the other day, but they were allowing only 1 or 2 customers at a time. If you're going in, there's a shortage of the hand sanitizer, you use the hand sanitizer if you do have it. Wash your hands 20 seconds all the time. So if you're coming in contact with the cards or anything that people might have touched, wash your hands. Stay your distance. My wife and I went grocery shopping, and we bought our groceries that we needed to buy, and we came back. And what we've done, we took the extra step. Of course, we washed our hands. We stayed our distance. We noticed that people weren't taking it seriously. We saw a lot of people actually interacting as if there were nothing happening. It was like, they were leaning on the counter and getting close to one another. I go, that's just terrible. There are some people holding some elderly where they're putting masks or a kerchief over their face as they were doing. There's recommendations that we should not wear masks because what happens is you're touching the subject. Some people wear gloves. There's a shortage of it. But they're saying that if you have the mask, then chances are you're going to be trying to fix it, you're going to manipulate it, and you're going to actually touch it more than you would normally not without having it. So you wouldn't touch your face at all if you're disciplined enough to say, okay, I can't touch my face. And so I would say not to touch your face. The mask may help. There's talk about not having it, not using it, because the fact that you constantly have to readjust it, and you may, if you touch a surface area with COVID-19, you may introduce it to your body by touching your face.
In a previous conversation, you had mentioned the value of also, after you wash your hands, of washing your face. Is that still your opinion as well?
I do that several times. I do it at night. I do it before I go to bed. I do it in the mornings. And of course, you're going to take a shower. I just make common practice. Go back to the old-fashioned way of doing things.
So is it true that the virus can't really penetrate through our skin? It's going to go through the openings of our body. Is that how we're getting it?
That's correct. Your skin is keratinized, which means there's a layer of protection that's really like a mesh, iron mesh, that's a shield that you cannot penetrate. But what happens is that sometimes we overwash our hands. So people are washing it, or using the hand sanitizers, and they're getting dry. So you got to make sure you hydrate your hands with a cream or something. And so if there's a break in your skin, then that can introduce the pathogens into the bloodstream. So you want to make sure that you're always, you don't overdo it, but you do it when necessary.
Yeah. So that's very interesting. So what you're saying is when I touch a surface, I'm not contracting COVID-19 if that virus happens to be on the surface. It's when there's a crack in my hands or a cut, or if I touch my face and my eyes, my ears, my nose, my mouth, I'm actually conveying the virus to those vulnerable spots in my body. But if I just happen to touch a surface, I'm not getting sick from touching that surface. Is that what you're saying?
Well, if you're touching the surface, if the virus is on your hand, let's say you touch the shopping cart or something, and the COVID-19 is on that virus is on there. And there's many other viruses too, not just that one, and bacteria that's on these things. So you touch it, you have it in your hands. Now, it's that you're not going to get sick, but you have to go and wash your hands. I mean, you can introduce that pathogen now if you touch your face. That's the form of entry. This is the gateway where it goes: your mouth, your eyes, your nose. So don't touch your face, wash your hands. And that way, but if there was a break in your skin also, I mean, that's why another more reasons to wash your hands, because then you can get rid of it and disinfect it.
But that's one of the reasons why it's so important for us to make sure that we are using moisturizers and things like that, so that with all this extra washing, we don't get cracks in our skin.
That's right. I mean, the gel itself, the alcohol wipes and the alcohol rubs has a tendency to dry your hands. So we got to make sure we hydrate them as well, and use a mild lotion or something to actually, make sure we keep that skin the integrity of that skin really good.
Over the past week or two, I've heard multiple reports from several of my medical professional friends of the long lines at the various hospitals of people that are coming in hoping to be able to get a test. At what point should people get a test?
If you feel like you have COVID-19, if you feel that you had these symptoms, and actually if you go on any one of these sites and you will call your healthcare professional, always call your healthcare professional. That's the first place. If you feel that you have it, call them. You may not exhibit even the symptoms that I just said. So there are some people that are asymptomatic. They may not actually show the symptoms, but they're carriers. This is why they're asked people to stay home and be quarantined for this period. The governor's asked, the president's asked. So we need to follow these rules, what they've set forward. Right. And if you feel that you have this virus and you feel that you're having these issues, then call your healthcare provider. That's your first line.
So we've had a few people ask, they seem nervous about the testing process. What precisely is that testing process? How are they going to find out whether or not we have it?
Well, there's many ways of the way the test is being done. They'll take a swab. So usually they'll take a swab of your back of your throat and your areas, and then there's a solution, and that solution goes into and they measure it, and there's a little pathway of how it used to be. Now that people are waiting a week to get the results. I think the FDA has just approved a new. America's actually found a test that's even much faster. So we actually can get those results in hours. That's not out yet, but in the meantime, you will get this test. You'll be tested, and they'll quarantine you, self-quarantine at home.
Good. So you believe that on the near horizon, there's a test or a process to be able to get the answer back quicker. That's coming soon.
Yes, there's something you probably heard it on the news and the radio. There is a test that's coming out that's a little faster, and that's going to separate us. It's going to say, okay, these guys have the disease, these guys don't. So there's going to be true positives and false negatives. We'll be able to ascertain who has the disease faster. Because right now, everyone is in fear and panic, and we should plan. We should be here. If you have these symptoms, call. And like I said, take that time off as a sabbatical and just do things at home and keep yourself active. But at the same point, if you do have this virus, you'll be tested. You'll get those results, and you'll know. And then, if there's an emergent need for you to go to the hospital, then they will call you. Don't go to the hospital. They don't want anyone with COVID-19 to go to the hospital.
They don't want us to go to the hospital until a medical professional tells us to go to the hospital.
That's correct. That they ascertain that, look, you need this, and then they'll make special needs for you to come.
Okay. So I think the question that's on everybody's mind, in your opinion, and I know that you're not, the head of the CDC, but in your opinion, how long is this going to last in Michigan?
The reality is, look, that's an interesting question, and it's tough, and we're changing. Had the president did the best move, which was stop the flights from traveling and stop the flights coming from China. So when we're looking at models like the Italian model, they didn't stop those flights. They kept on coming, and a lot of those flights were coming from Wuhan province in China, back and forth, until they had a critical mass of the number of sick, and they stopped it. So you're seeing most of the cases in the two coasts, the East Coast and the West Coast, because these flights were coming in back and forth from their respective, globally. And so what you're going to see is, I think you're going to see these numbers. I'm hoping that these numbers we are able to maintain and control it, and it will not be like Italy. It'll be a lot less.
Good. So I think the curve there has been a few months already. So do you believe that this will go on in close to summer?
Look, the reality is, let's say ground zero starts, let's say it started on Monday, right? And so 2 weeks quarantine. It takes 2 weeks, so the virus can actually manifest its symptoms. You can manifest these symptoms in 2 weeks from contracting the disease, and any time in between. Mm-hmm. So let's say that you contracted it on Monday. Okay, so 2 weeks from now, you would have the disease. So what they want to do is they want to self-isolate. So we would know that people who have the disease currently and people in the past, under that curve, everyone who will show signs and symptoms of this disease. We'll have a better idea of who has the disease and who doesn't have the disease. The problem is now that only takes us to the marking point and says, well, who has the disease? And who doesn't? It doesn't tell us anything more other than the fact that we need to deal with helping the people with the disease states and not having new people get infected.
Right.
So there's a good chance that this thing may last unless there's some good hope coming up. And I do believe there's some good progress being made. That we may take this, it may go a little further than the 2 weeks that we actually anticipate.
Okay.
It very well may be into April, and probably May being normality.
I know both of us have had extensive communication with the state level governor's office and then also with the White House. But in your opinion, how has the response been so far on a state level and on a federal level? Are you content with the response, or what's your thoughts on those things?
I think this country, John Hopkins University came up with some kind of analysis and said this country, the United States, was the best country to handle the way this disease is being handled. And I think from Governor Whitmer, we may think that she's doing her best in trying to contain this, and as well as the President of the United States has done his best job. And obviously, there's universities and hospitals like John Hopkins who've actually claimed that, look, we've done the best we can. We're increasing the testing kits that we need. We're actually mobilizing breathing units, and that's the big one. That's where our bottlenecks are, trying to make those units as fast as possible for the ones that need it. They're looking for beds that we need to hospitalize these patients and building new units. But it will get worse before it gets better, because you'll see all those people that are sick now manifest those symptoms next week. And so that's the time they're going to need all this help. And so the country is mobilizing it, and I think they've done the best job from the reports I've read.
I saw that one of those same reports from Johns Hopkins University, from the hospital there, and I think that report came out actually last fall, didn't it? Saying that the United States was the most prepared for a global pandemic kind of a situation, and of course, even with us, we've seen now being overwhelmed by it, or potentially overwhelmed by it. You brought up a couple of interesting things, and it seems consistent with some of the questions that are coming in right now. With regard to equipment and all those things, what are you particularly hearing on a local level from the local hospitals and local health workers with regard to their response and their equipment and all of those kinds of things, their vulnerabilities?
So, staff, and throughout these podcasts, we're going to be with the American people. We're going to stay with them from what you and I have discussed throughout this whole ordeal. We will be here for them. We will give them information. And what I'm planning is to have some of those physicians that I've worked with, some of those department heads, infectious disease, come online with this program. So some of those questions will be able to help with that. Right now, as it's a new evolving situation, we're trying our best, and Michigan's doing their best job they can to prepare and accommodate. So I would like to save some of those discussions when they come on. So, because they're frontline right now.
Okay.
They're there.
Very good.
I'll tell you what the ER is doing. I'll tell you what the OR is doing, and what infectious disease is doing, and the timing of the tests. So, healthcare professionals are obviously at risk. They're the highest risk because they're seeing everyone that's coming in sick or well. And so everyone that's coming in the hospital usually is not well. And so they're the front line. They're the front line. So they're getting tested. I know one doc is right now, I spoke to him. He's supposed to be on the show. He is the head of cardiothoracic. And he said to me, I haven't had my test. I'm waiting for the results. But I'm not going to go unless I'm not touching a patient unless I can confirm that I don't have the disease. So that's
Wow.
how healthcare professionals are handling this, and they're taking it seriously.
So we'll have some of them on a future episode. We'll bring in some of your other doctor friends and things for that purpose. So we'll be able to get into that. Well, let me ask you a few questions from our people that are sending in from Facebook and YouTube. One of them, and this is very interesting, I've heard this before. For asthma sufferers, are nebulizers safe or not? I've heard mixed messages, is what the person wrote.
I think from that one, not knowing that person's case, you should be talking to your pulmonologist or your primary care on that and check. There's different levels of asthma. So you would really, that's something that you should ask. Obviously, if you're home, if you don't have COVID-19, you should continue to do what you need to do, be told. And again, you need to have, I don't want to offer any of these medical advice, but that's something between you and your doctor. That should be, I think a lot of the doctors are open, they're available. They're usually doing, if you're not being seen in the hospital or the clinic, they're doing telemedicine, so they're doing a phone call. So that's something that you should continue to follow the instructions of your physician.
Okay.
That's the best person to address those issues.
But as you mentioned, just to clarify, you mentioned if they're not exhibiting COVID-19 symptoms, then continue doing what they were instructed to do by their doctor. If they have questions, follow up with their medical doctor.
At this point, like I said, the best person to answer those questions are your primary care.
Okay, very good.
Internal medicine, or your specialists that you're seeing. There's a lot of false stuff out there. And of course, this show is we're trying to talk about policies, but the main person, and absolutely don't listen to anyone other than your physician. So your healthcare provider is the key. Obviously, the state's giving you some guidelines and following preventive medicine and preventive for disease. But the only person that you should be taking orders from or instructions from is from your primary care.
Very good. And then there's another question. It says, I'm interested in how the medical equipment, including ventilators, how that shortage is going to be addressed, and then if decisions to determine who's going to be provided appropriate care and who will not be are happening on a local level. And the reason is they say we have a disabled child. This really concerns us. So I think the question is, they're asking two. One is, how soon are we going to see more ventilators? And the second one is, who's actually going to make a decision of whether or not their child is going to be cared for, who gets help and who doesn't? Who's making that decision?
So everyone that is sick will be looked after. I mean, having a disabled child does not exempt you or prevent you from being treated. You're going to be treated respectfully like everyone else. And so if you exhibit those conditions, you will get the care that you need and that you deserve. And the fact is that there's no one playing God in who gets this, who doesn't get this. So definitely everyone will be treated well. As far as the machines are concerned, you can see the president's passing orders, and many Ford, from what I was reading, that there are multiple companies trying to increase production of these machines. And so I feel that we're making strides in trying to get the masks that the healthcare professionals need, testing kits, and the equipment, the respiratory machines that we need. And so I'm praying and hoping that this is where we're heading, that we will have enough.
Good. Another question is, if you have cold-like symptoms and it doesn't develop into anything serious, like a fever or harsh breathing, but you've got the other things, the sore joints and kind of the flu-like things. If it doesn't develop into a fever and breathing issues, should you leave tests for others, or should you go get tested if you just have some of the symptoms?
You should report any type of, if you feel that you have COVID-19, you should report it. You will eventually get a test. I mean, you should report this to your primary care or your healthcare professional.
Okay, good. And then one last question that came in from our viewers for now is, what are other ways that we can protect ourselves when we can't find alcohol or hand sanitizer or bleach or other disinfectants? Do you have any secret things to tell us that would help?
I think there's a couple good sites from the CDC. If you go to my site again, drbishamsingh.com, there's a list that the White House has. We've had White House briefings in which we've actually put that in for our website for faith-based people and just for our community, from all of them, so they could have access to what are the steps we could do. And so if you go on there are mandates that have been given, even the Michigan Department of Health and the federal government and the CDC. So if you go on there, you can actually glance down, read it. You'll have it verbatim and what pertains to you and how to handle it.
Okay. Then here's the final word. What did we not talk about? What was I not smart enough to think to ask you that you think is an important thing to say as your final word?
I think we've done the beginning, introduction. I think plan instead of panic, and don't have fear. We will come out of this. We'll come out of this stronger. We will come out of this united, and it will be better. And so we've always risen above everything else. I think you being a pastor and praying, making sure that we keep our faith. And at a time like this, follow proper hygiene and the rules that were set forth by the government and our healthcare providers. Making sure that things are your site, from what I was told, has ability to help people if there's need of help, and if there is a crisis, call those hotlines that are available,
Hmm.
and then reach out. There is help. We're not isolated. We're quarantined, but we have help. Things are available, and we should use those resources when it's needed. If you need help, your church has done a great job at providing help, and there's many others that are coming out. And it's bringing the country, to be honest with you, behind all that chaos, we're actually coming united. We're becoming very united, and that's incredible.
I agree. It's a unique time.
Life. Yeah, yeah.
Yeah. So, from my perspective, this isn't a secular issue or a religious issue. This is just a human issue. It's a good neighbor issue, right? And so, if you, no matter where you're coming from, no matter what your faith background is, the reality is, as a good neighbor, we have an opportunity. I think that Americans are best when we run at a problem to solve it. We're not all that great when we're hiding, but when we decide we're going to do something to address these issues. And so we have set up a website that would allow you to, there's one button that says Get Help, and there's another button that says Give Help. That website is heritagechurch.com, and right there on the main page, there's Get Help and Give Help. And if you need help, we can't guarantee we can solve every problem, but we do have people that are stepping up with regard to food and basic household issues, people that are willing to maybe do some shopping for you, or that maybe can pick things up for you if you need to. So on the Get Help side, click that button, and there's a form to fill out and give us some information to be able to help you. And then on the Give Help side, we can receive donations. Many people are dropping off, you have 1,000 rolls of toilet paper. So some people are dropping off a package of toilet paper, or maybe they're buying 10 cans of green beans and donating 1 can, that kind of thing. And so we are very happy to receive those donations. We have already had a system in place for a number of years, feeding the hungry in our community and those that are maybe in a food shortage situation. And so we serve hundreds of families every single week, and we have the ability to distribute. We're also connected to the Macomb County Food Bank, Emergency Food Bank, and they're providing resources as well. So hopefully we can do what is necessary. But if you'd like to make donations, that's important. Also, we need people who can volunteer maybe to pack care boxes, and that way we can already have them pre-made and deliver. And people that are willing to make phone calls to call on your neighbor. You don't need to connect with us to do that. You could just start following up with your neighbors and your family members that are loosely connected to the rest. Dr. Burks said that this social distancing should not result in social isolation. And so it's on all of us to make sure that we're following out the people that we love. And then also, we could use a few volunteers to help us with delivery and with shopping and those things. Now, what's going to happen is there's a rise right now in people willing to volunteer and not as many needs. But what's going to happen is there's going to be a convergence of those two things within the next week or two. And so we want to stock up on supplies now and stock up on volunteers and get them in our system so that when those two things start to collide, that we're able to respond in an effective way and serve our neighbors. And this is not a religious thing. It's not a secular thing. It's just a good neighbor human thing. So we want to invite you to do that. I also want to give you a couple things, if you would, in closing. Follow us and like us on social media. Whether we're talking about Heritage Church or Dr. Bisham Singh, check us out on social media. Share this video with your friends. And then please tune in again. Be paying close attention. We're going to do more of these. Dr. Singh has many friends on both sides of the aisle. And so not just from his perspective politically, but from both sides of the aisle, all in this area, very well-connected people. And so over the next few weeks, we'd like to do more of these episodes. So make sure you tune back in and let your other friends know. Do you have one last word to say, Dr. Singh, before we sign off?
Just remember, you're not alone. We're here to help you. We won't abandon you, and we are here to help you. Follow those rules. If you find that you do have that infection, like I said, any type of medical conditions you have, you need to check with your healthcare provider. Don't change anything because you're seeing it on TV or any website unless they're told to you by your doctor, because he knows your medical record. He knows what your needs are, and he knows how to adjust it accordingly. Sorry, that was not one word, but you're not alone. We're here for you.
Good. Well, thank you for watching this episode of The Doctors in the House with Dr. Bisham Singh. I'm Jeff Forster. It was my privilege to host you today. I just want to say God bless you, live wisely, and stay healthy.